The TrueFuse procedure is indicated for facet pain. Facets are a hinge on the back part of our spine. They sit side by side so they allow us to pivot. I always tell my patients it's the pain you feel if you mop or if you sweep, twisting maneuvers. If you get out of a car, that catch you get in your back. If you ever lifted something inappropriately and you get that grab in your back, that's your facet joint. As the facet degenerates, it becomes unstable. Obviously, you try to stay conservative treating this pain with anti-inflammatories, physical therapy. You can inject the joint, you can do a rhizotomy procedure where you don't feel the joint as much, but eventually those things stop working. Before the TrueFuse procedure, the only other option at this point was to put a rod and a screw into that joint to stabilize it. Not only do you lose mobility of the areas that are fused, but the adjacent levels above it degenerate much faster because those segments no longer move. What a TrueFuse procedure does, I can take a bone plug, it looks like a little dowel, and I insert it into the joint, and then I inject stem cell so it fuses the joint, it stabilizes. But there's still a little bit of mobility, so you still have some movement into that joint, so the degeneration above and below it is not as severe as with a major lumbar fusion. This procedure takes on the average of 20 to 30 minutes. It's an outpatient procedure, and it's done with a device that is very small as opposed to major incisions that are done to introduce hardware with a lumbar fusion.